Hey, good morning. It's Dr. Matt Bradbury here from One Life Family Chiropractic. We had some questions this week in regards to wrist pain. I had a few people. I don't know if they're getting back to exercise or increasing their volume or changing what they do at work. But a couple things I want you to remember is that your body needs some level of conditioning when it comes to your wrists. We can't take it for granted. So when you're out there and whether you're working out, doing a lot of extension all of a sudden, and you spend most of your day like this, and then all of a sudden you demand of your body to, whether it's a push-up, lift a weight, or get in an Olympic lifting position, remember that you have to build up some tolerance for that position. So if you spend a ton of time like this, and you're curved in and flexed, right? Spine's flexed, anterior head carriage, and your hands are generally like this, you're probably more developed through here, right? So your forearm flexors are probably very strong, and you may have some weakness through here in your extensors, and you're not used to all of a sudden getting into this position. So maybe these are really tight, these aren't as strong, and this is just awkward. So what I want you to try, keep some basic conditioning in mind, right? And remember, these things only work if you apply them regularly. So you may have gotten to a point where you're really uncomfortable. What I want you to do is think about doing a really good warm-up and then possibly changing the volume a bit. I don't like to say don't do something, but for a week or two you may have to decrease the volume by 20 to 50% just to give your body a bit of a break. And remember, you can do other things, right? It's not the end of the world if you can't do push-ups or you can't do a particular task of your job. You're going to get back to it. Always start with the notion when you're putting this idea in your head that your goal is to not just look after this month, but look after the next 80 to 100 years, whatever it may be. So I would start really simple. If you're at your desk and, for instance, something like this bothers you, right, or something like this bothers you, start building some tolerance in these areas. So I would keep it really simple and do one side at a time. But while you're commuting on the train or when you have a quiet moment in your car, when you park your car to go to the work, just hang out. You notice I said, does this bother you? All I'm doing is working on this side. So my right arm, hanging out in that position. And notice how I oscillate back just gently. Think about opening up. This is the easier version. As you want to make it more intense, come around like this and then eventually straighten my whole arm. So I hang out in this position. And I might hang out here. Remember, you're being too aggressive, you're starting to get numbness tingling, right? And if your grip strength is changing, that's something you want to be aware of too. And I mean, at any point, it could be a structural challenge up at the spinal level, nerves coming all the way out because your brain has to control your whole body and send messages down. Just bear with me, my assistant Grace is actually going to walk into the office, so don't be caught off guard. So think about opening up and then opening up just like this as well. Okay? So I'd keep it really simple and start building some tolerance, but don't forget any of these challenges. Hey Grace, come on in.
Hi.
Yeah. Any of these challenges could start with the main factor being your spine. Your brain has to control everything, send messages down through the nerves, control the shoulder, arm, all the same nerves also control your heart and lungs. You can go past it, you gotta go in. Yeah. So all this stuff's gonna be really important, and this may be secondary, or it may be a piece of the puzzle. So consider all these factors when you're starting to look after something such as wrist or elbow pain. So I'd start to open up, I'd hang out here, and again, you can do a slight little oscillation if you want. Just breathe. And this may be your pre-warm-up before you work out or before you get to the desk right now, because maybe the desk feels like you're 8 out of 10, with 10 being the most intense exercise ever, and that's okay. That's why you're watching this video, trying to improve how you move and your overall level of health. The other thing I would do is actually, if you're doing a lot of all of a sudden extension movements, I would start training my extensor muscles. So all through here, right? I would actually start as simple as the water bottle, and you can rest your arm like this and start training the back of your forearm so that you're not so overdeveloped and tight through here in the front of your forearm. You also build up some tolerance and strength through here. With this, typically these muscles are more, I would like to say, endurance trained. So you might do 15 to 30 reps and just hang out when you're in your off time, a couple sets a day in the morning, and then whether you're at your desk. And I like to do, when I'm thinking about my wrists and working out and all of a sudden getting into these extension positions, especially when it comes to something like pressing or push-ups or the bench press, is actually before you work out, spend some time with a band. just going into extension back and forth. And again, I would do 15 to 30 reps and just get these muscles used to working so they actually engage, and there's a better connection, a better neurological connection as well. If your brain's firing really, really well to say, hey, coordinate, there's a warm-up period. So take those 2 points home. Anything else? I think really that would be it for if I was just starting out. Remember, a lot of the time, most of these things are built up on our habits. So if you change your habits and make some small little tweak, it will change your level of health. And if you can keep that in mind, you'd be a heck of a lot better off in the future, because you'll realize that, hey, what am I doing right now that's getting me to this point? And what do I need to change to get me to the next point or to help me level up? Anyways, I hope you're doing well out there. Have yourself a great day, and I'll talk to you very soon. Bye for now.